I'm going to begin by performing some hand hygiene. I'm going to provide my patient with some privacy. And then I'm going to introduce myself. Hi, my name's Missy. I'm going to be your nurse for today. Can you just say your name and date of birth for me? Okay, I'm just going to verify with his wristband. Good. I'm going to explain that I will be doing his feeding for today, and if he has any questions. No questions? Okay. I'm going to put on some clean gloves and explain that I'm going to start with an abdominal assessment. To do this, I'm going to lay my patient flat. Before doing so, I'm going to make sure that my patient is okay to be laid in the supine position. And my patient is. Okay. So I'm going to raise the bed and put his head back. Good. Okay. I'm just going to perform the abdominal assessment. I'm going to begin with inspection. There doesn't appear to be any distension, no cuts, no bruises, no bumps. Next, I'm going to auscultate. Okay. Okay, bowel sounds are present in all 4 quadrants. Next, I'm going to palpate. If you have any pain, please let me know. Okay, I feel no distension here, no masses. Now I'm just going to go a little deeper. The patient has no pain. Okay, good. That concludes the abdominal assessment. I'm going to return my patient to a 30 to 45 degree angle. Okay. Next, I'm going to bring my supplies on over. I'm going to start by laying a chuck down under my patient. Okay, now I'm going to lay a chuck down here. I'm going to begin first by verifying that an x-ray has been done to show that the tube is in the correct place. Along with that, I'm going to measure the tubing from the port to the tip of the nose to verify no movement in place. Okay, I have 27.5 inches. I would compare that with the number in his chart when it matches, clarifying that the tube has not moved. I'm now going to begin by checking for pH. To do so, I'm going to clamp, then unplug, insert my syringe, and I just need a little bit of amount. I'm going to unclamp and I'm going to pull back maybe 10 milliliters, if that. Okay, I'm going to clamp again before removing my syringe. Recap. I'm going to come over here. I'm going to expel it into my jar here. First, I'm going to notice its appearance. It's greenish and it has a liquid consistency, which is accurate for stomach acid or stomach contents. I'm now going to measure its pH. I'm going to do this by sticking the pH strip in here. Next, I'm going to detect what his pH is. It is less than 5, indicating proper pH for the stomach. Now I'm going to check his residual volume. I'm going to do so using the same syringe, clamp, uncap, insert syringe, and I'm going to take out all the fluid or all the contents in his stomach. Okay. Now I'm going to keep doing that until there's nothing left. Once there's nothing left, I'm going to measure. If it is less than 250, then the feeding can proceed. If it's more than 250, you need to hold off on the feeding. This gentleman's is less than 250, so we are going to continue with the feeding. First, I'm going to just return his residual volume. Unclamp. Okay, and then clamp. Now before I begin feeding, I'm just going to flush the tube with some water. I'm going to open, pour in some water, and I'm going to want 15 to 30 milliliters of water here. Okay. Going to clamp, unclamp, and push in that water. Okay, I'm going to clamp again. Okay, now I'm ready to begin the feeding. I want to make sure it's the correct formula. I want to shake it, make sure it's not expired. Also, I want to be sure of the proper amount that has been prescribed for my patient. Okay, and then I'm going to wipe the top of it off with an alcohol swab. Okay, so I'm going to take a new syringe now, and I am going to clamp yet again and uncap, and I'm going to put the syringe in. This time I'm just going to take the plunger out, and I'm going to hold this at a reasonable height, not too high, not too low, and I'm going to pour the prescribed formula into the syringe until the amount has been met. Once again, not too fast or not too slow, and once it becomes 3/4 of the way empty, I would clamp again and reinsert the solution, and I'll continue that process until the prescribed amount was given. Once again, I would unclamp and let it go until my patient has received the proper amount of feeding. So now that his feeding is done, I'm going to clamp, take my syringe, and I'm going to rinse the tube with water, yet again, this time with 30 milliliters. Okay, I'm going to come over, clamp, uncap, insert, unclamp, and flush. Okay. I'm going to leave my patient in at least a 30-degree angle for at least an hour, and I'm going to assess him within an hour. Make sure he's doing good. I'm going to remove the chuck pad, restore my patient's comfort, make sure his stomach's okay. I would remove my gloves, perform hand hygiene, and return my patient to the lowest position on the bed with the call light in reach. And that concludes the NG2 feeding.